Okay, welcome back. We're going to talk about bed sores now. This is very common in some patients who were admitted in ICU, old age patients, the patients which are not taken very good care of, or the patient who are having a stroke or very prolonged surgery, or the patient is in coma, or the patient is in ventilator ICU support. We don't want you to have bed sores in the first place because the treatment and the outcome is difficult. And if very good thing we can do is to avoid it in the first place. Here, that this thing works very perfectly fine is prevention is better than being cured, because once these things develop, the treatment is very difficult. It can recur again, and it takes time to heal. It can have infections, cellulitis, and many more complications can take place. Right. So we're gonna talk about bed sores in a little bit of detail. Okay. This is how a bed sore will look like. Okay, you can see the area over here. All right, so we have another bed sore here. We have two bed sores here. Okay, so we're gonna understand where are the bed sores actually most likely to develop. Just imagine the patient is lying down. Okay, the patient is lying down here. So you need to understand, because of the weight of the body, there's always amount of pressure around the heel area, buttock area, the elbow, the shoulder, the back of head. Very important. You will be having pressure there. And if the patient is in ICU, most likely you'll see the patient is in almost like in a sitting position. There will be a bed here and supporting somewhat like here. So head, shoulder, in the buttock area, okay, and in the heels. Now, this pressure is not bad in the first place. Everybody, whenever you sleep at night, you're having pressure, okay. Anytime you're sleeping or taking rest, you're having pressure. But the problem arises if you're having this pressure for a prolonged time. So approximate time is around 2 hours. So if you're staying in a constant position for more than 2 hours, the chances of developing bed sores in that area increases. So just to give you an idea, whenever you're sleeping at night also, so you're changing a position very often, right? It's not that you're sleeping steady. You're changing a position every around 2 hours, right? So if you take up a camera and just place it onto your bed, and when you um, check the video later, you will see that around 2 hours you're changing a position couple of times. So whenever you're changing a position, what happens is that you are actually reducing the pressure and reducing the chance of developing of a bed sores, right? So a patient who is having an ICU support, who is ventilated, everybody has to go now. Okay, never mind. So when the patient is then in the ICU support, he is ventilated, he is intubated, the patient is collapsed, the patient is not responding, is unconscious. So the patient is not going to change the position. So you have to be careful. The patient party, the patient nurse, the physiotherapist and the healthcare professional, workers, technicians, they have to be very on the tiptoes in order to make sure the patient is not in the same position all the time. But unfortunately, you have to understand, every single detail is not very well, what how can I explain, it's not very well optimized. It's not very well implemented, because the amount of patients and the amount of working force, the amount of nurse, the amount of nursing stuff, and having the amount of patients is phenomenal. Around like 30-40 patients is managed by one or two nurses. Man, those guys can't take so much of care. They're not having enough time to sleep. It's too much of pressure, less amount of man force, less amount of women force, whatever force, less amount of medical force, and the amount of patients is enormous. So sometimes what happens is that it goes neglected, right? That's a drawback. So we need more amount of medical professional and technician and all these guys we need in order to avoid developing bed sores, right? So, nevertheless, you cannot blame the nurses because they're overworked. Hands down, overworked. Too much of work these nurses are doing, and the amount of sleep, amount of time, amount of rest, and the amount of output they are giving is too much, enormous, right? No doubt in that. So, nevertheless, you have to make sure that the patient is moving in every 2 hours. So, if you're the patient's party, you're the patient's, parents or family or friends or partner, you need to make sure that your patient is moving in every 2 hours. Very, 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 very important, right? So the risk factor of these people, who are these people lying in this? Coma patients or patients who are intubated, the patients who are unconscious or prolonged surgery is taking for, like, 6, 7, 8, 9, 10 hours. We need to check the patient, that did the patient start to develop signs of bed sores or not, right? And patients who are in ICU, most of the patients in ICU are always in a very critical state. So those patients will be having a chance of having bed sores, right? So okay, so how do you prevent it? So it's very, very important that you use a air mattress. No, you don't want to use a hard mattress. So this is an air mattress. So this is a device. So it automatically adjusts the level of air inside the pockets. So whenever within around, you can set the timer. So it will inflate and deflate the mattress. So it will help you to reduce the pressure in the exact point. So the pressure is relatively distributed. So it's very, very, very important. So you are never supposed to use a hard mattress for sure. Okay, to avoid bed sore, or if you have developed bed sores, to reduce the progression further. Okay, and the next thing is very important, is that unfortunate thing is that you should not use a plastic sheet, because most of the patients are going to pass urine or pass stool. It's very difficult to clean the bed, right? So sometimes what the cleaning stuff, what they do is that they actually put a plastic sheet. Now remember, whenever you're putting a plastic sheet, the fluid that is coming out from your body, that is the urine and the feces and stool, it's not going to get absorbed, nothing. So all this time this is going to increase the friction, increase the bacteria in the fluid. So the environment becomes very dirty. So it helps you to develop bed sores very early, right? So you never ever use this plastic sheet. Always use a cotton sheet, which is going to absorb it. Okay, and you need to keep the area clean. Very, very important. And another thing is your okay, all right. So another thing is that you have to make sure that the diaper that you're using in these patients are clean, because you cannot have a diaper which is having stool for a prolonged time. If you're having stool in a diaper for a prolonged time, man, the pH of the stool is less. That means it's relatively acidic. There's a lot of microorganisms. There's a lot of acid. So all this combination is actually affects the skin around the buttock area. So you will be having more chance of developing the bed sores, right? So very important that you don't want to have diapers which are not clean. You need to clean the diapers very frequently. Okay, you should not have stool in the diaper and keep the diaper um, intact. You need to check diaper time to time. Very important. Another important is that you need to make the patient sometimes lie in this position, sometimes lie in one other side, sometimes lie in another side. It's very, very, very important. You have to make the patient lie in the back. After 2 hours, shift the patient towards left side, and after 2 hours, shift the patient towards right side. It's very, very important to help you to avoid bed sores, or if the bed sores are already developed, it will help you to minimize or stop the progression, or help you to recover from bed sores. Very important. Every 2 hours you have to change the position. Changing the position is phenomenally important, man. It's very, 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 very important. All right, so once this thing is done, what are you actually supposed, like, if you just flip into the medical reports, you are going to actually see um, two tests which is very important. Is the liver function test. In liver function test, okay, so this is diaper. You don't want to keep the diaper wet. Okay, so whenever, okay, we are going to check out for two different things here. All right, so you're going to check out here liver function test, and this liver function test, you're actually supposed to see the protein. So this is the albumin, right? This is the albumin here. The patients who are having bed sores, if you see the liver function test, most likely you'll see the albumin level is low. So albumin is protein. You need protein, high amount of protein in the body, in order to help the body to heal. It's very important. If you do not have protein, your body is not going to heal. So what are the sources of protein, man? You have to eat a lot of pulses, grams. You have to take protein powder, whey protein, what is easily called. You have to take some milk, cottage cheese. You can take paneer. You can take eggs. Very, very, very important. You have to take eggs, soya chunks. It's very important. You need to increase your protein intake. This is albumin. It's very, very important that you take good amount of albumin in your diet. Albumin means protein, right? You have to take good amount of protein in your diet. Very important. And another thing, you have to make sure that the hemoglobin of the patient is normal. See this, in this case the hemoglobin of the patient is just 7.4. It's very very less. Okay, it's 11 to 13, and normal 11 to 13, maybe 14 15 also, depending on the labs. But if the patient is having low amount of hemoglobin, the bed sore is going to take a lot of time to heal. So how do you increase the hemoglobin? It's very important, very easy. If the hemoglobin is around 7, directly it's way too low, we cannot wait, so you have to directly infuse direct blood, okay, whole blood. If it is around 10 or something like that, or 9 or 10, we will immediately supplement with iron supplementation, right? Obviously you iron supplementation again will cause you discomfort in the stomach because it is corrosive, but you need to take the iron supplementation. And the diet is very 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 important. You need to include a lot of stuff in your diet which are highly having high amount of iron in it, like spinach, very important. Spinach and green leafy vegetables very high in iron. And also your eggs, and then your apple, pomegranate. It's very very important that you take good care of your diet, including your hemoglobin and your protein. It's very 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 important. If these two things are maintained, right, so the patient will be able to recover from that case very quicker. So what are the risks, what are the tension that can occur if you're having bed sores? Very important. You can have cellulitis, man, it's very dangerous. Or you can have joint or bone infection, right? It's very very dangerous that you have a bone infection, or you can go in sepsis in the first place. So you don't want to have all these things, right? So if you make sure if you see the patient, keep the patient, the albumin level is good and the hemoglobin level is good, most likely the patient will recover relatively faster. So it's very very important, and very important from the patient side, and very important from the caring staff, and also from patient side as well. And you always cannot complain about the nursing staff or the caring stuff. It's impossible. It's impossible for a human being to work so much how a nurse is working, right? So this is also a good message for the patient party in order to take care of their patient as well, because ultimately we want the patient to be healthy. Doctors are working, paramedics are working, technicians are working, nurses are working, physiotherapists are working, radiologists are working, and the patient part is also working. If everything goes into a sync, definitely the patient will come out very nice. All right, so yeah, that's all for this video. I'll see you in next video. Thank you.